From Perth to Melbourne, Australia's hospital system is at breaking point. And experts say the winter surge in COVID and influenza is only going to add to the pressure.
Our hospitals right across the country are chock-a-block full, so we're extremely vulnerable to another wave.
That wave could be only weeks away. New COVID variants are proving to be more infectious and potentially more dangerous, and authorities fear the community has become complacent.
It's a bit like frogs being boiled slowly because we're getting used to and desensitised to the number of people in hospital and who are dying.
Since April, COVID cases have been falling across the country as the worst of the Omicron outbreak faded. But that dip hasn't lasted. In recent weeks, cases have started to rise across the country. Looking at the surveillance data out of New South Wales, it's the newest variants of Omicron BA4 and BA5 that represent about a third of these new cases. Experts say they expect these new variants to be the dominant strains in the next few weeks, fueling the surge in new infections.
And the concern with BA5 is that we might actually see more people who are particularly unwell. It's been described by virologists as a sticky variant.
62-year-old Jackie Driver has caught COVID twice in 12 weeks. Living with rheumatoid arthritis, she had to take antiviral medication both times.
I'm on some very strong medication to control the arthritis, and what it does is destroy your immune system.
Now on the mend, she's conscious of catching the flu.
I'm definitely going to be wearing a mask this time.
There's already been a sharp surge in lab-verified influenza cases. Part of this is because we've never tested for influenza like this before. In some instances, COVID PCR tests are also picking up the flu. But nevertheless, this is a particularly bad season. Compare that to 2020, when large parts of the country were in lockdown, cases were extremely low. But when we add this line here, 2019, that's before the pandemic, you can see we've already got roughly 3 times more influenza cases, and we're not even halfway through winter.
There will be some relief when we start to see the flu circulation slowing down.
To help ease pressure, authorities are urging people to be up to date with their boosters. If COVID positive and eligible, take antiviral medication and get the flu jab.
Is the three-pronged attack which really needs to happen across the country to really avert a real potential disaster.
Because otherwise Australia's health system has a long winter ahead. Cayman Gok, ABC News.